This 50 years old female patient presented with pain, photophobia, redness, watering in the left eye for the last few weeks. When I examined her, her vision was 624 in the right eye and counting finger in the left eye, and both corneas were filled with breadcrumb like opacities. You can see the right eye cornea here sparing the limbus. On further inquiry, she confirmed that her vision is decreased in both eyes since childhood, and these tiny white round opacities are also present since childhood, and with age progressively increased and gradually decreased the vision. And then few weeks back, maybe due to rubbing, because the patient doesn't know the exact cause, ulcer was formed in the left eye that rapidly progressed due to already compromised cornea due to dystrophy. So there is inferior paracentral corneal ulcer in the left eye that is causing these symptoms. So I diagnosed this lady with a granular corneal dystrophy type 1 and left corneal ulcer. Now, what is corneal dystrophy? Corneal dystrophies are a group of non-inflammatory, inherited, genetically determined, bilateral, slowly progressive disorders of the cornea with characteristic patterns of corneal deposition and morphological changes. Now, these can be epithelial, involving the epithelium of the cornea, stromal, or endothelial. Stromal. This is a stromal corneal dystrophy. Stromal can further be divided into granular, macular, and lattice. So this patient is having a classical advanced granular corneal dystrophy type 1, also known as Granov type 1, autosomal dominant. When it first starts, discrete breadcrumb-like opacities are appreciated on the slit lamp in the central anterior stroma in both eyes, with normal vision and no symptoms. Early, there is a clear space between the granules. Another important feature is that it doesn't extend up to the limbus. With aging, the crumbs increase in size, the clear space in between decrease, and a time comes, like in this case, when opacities coalesce and vision deteriorate. But as it also extends anteriorly, involve epithelium becomes defective, recurrent corneal erosions occur. And also these opacities extend deep into posterior stroma that further decrease the transparency of the cornea. In this patient, cornea is abnormally thick and opacified, and such cornea is also prone to infections. So here in left eye you can see, maybe due to rubbing, inferior paracentral ulcer is formed. So I started topical antibiotics, antifungals therapy with ointment at night and artificial tears during the daytime, and will follow this case at the end. A helpful mnemonic is Marilyn Monroe always gets her man in LA County. Now that's important because that tells you type of stromal dystrophy, its depositing material and stain, like Marilyn Monroe always. Macular mucopolysaccharides Alcian blue gets her man. Granular hyaline deposits mesenteric LA County, lattice amylide Congo red. So you should also remember this mnemonic, and when the vision becomes too much decreased, keratoplasty can be done. Thank you very much.